Tanais Dalin Alilin. Yes, I'm Canadian born, and I came to London with my husband in 1976, so I'm now British and Canadian. In the early 80s, I was asked to do photographs for authors like Sheila Kitzinger, Miriam Stoppard on their pregnancy and birth books, and I became very involved in that subject. At the same time, I was doing work in development with agencies like Save the Children and Oxfam. But I was always attracted to that mother and child, or the mother and child breastfeeding. I ended up into filmmaking. I then went on and did my own film called Birth 8 Women's Stories, which, beginner's luck, I won a gold award at the New York Short Film Festival in 1994. But it was in the late 1990s that I was commissioned by CEDA, the Canadian International Development Agency, to do a very in-depth photographic reportage on the subject of safe motherhood in Bangladesh, Indonesia, and Pakistan. And I came back from that body of work being able to show you why women died due to pregnancy-related causes and babies were stillborn. And it was CEDA who gave me the opportunity to present during International Development Week on Parliament Hill in Ottawa. And the then Minister of Development introduced me and whispered in my ear that she would only be able to stay for the first couple of minutes of my presentation, as she had cabinet ministers waiting for her. Not only did she stay for the whole presentation, but she stayed for the Q&A afterwards. And that was my epiphany moment, where I felt that is the power of the visual to help to influence people, to change their perceptions, raise their awareness about big issues, and potentially to invest more in maternal and newborn health. So it's because of that moment that I started to look into founding my own charity, which was founded in 2003, called SafeHands for Mothers. SafeHands' vision is to help to reduce maternal and newborn mortality. How we do that is through the production of films. Two types of films. Films which educate frontline health workers in Ethiopia, known as health extension workers, or films that raise awareness about big issues like child marriage, HIV/AIDS, female genital mutilation cutting, and how we get our films to very remote, isolated areas like Afar, Somali region, parts of Amhara, SNNPR, Omo Valley, is through our innovative, designed, portable, solar-powered DVD media players, which are carried in backpacks by the health extension workers. So when she gets to a remote area, and sometimes they have to walk 3-4 hours to get to a village, it's the power of being able to show a very strong, well thought out visual message whose people in the film are the same people as those watching them, i.e. Ethiopians. So in Ethiopia itself, we have worked in most of the regions. We've worked closely with the regional health bureaus, with our partners, the Family Guidance Association of Ethiopia, with UNICEF, with UNFPA, with WHO. So we've really, Population Council, we've really worked with the majority of NGOs who are working closely in the field trying to make a difference.